En ng'oindet ne chametabgei nebo borto ko kiy age tugul, nyorun konetishet ne inegen kobun ng'omutik chebo chametabgei nebo borto. Nai chechang akobo kerichek koboto konetutik chebo ole kiriptoi borto eng tetutik chebo komonut che inetin akokonin naet neo. Iyanech eng logoiwek tugul chenin chetinyegei ak chametabgei nebo borto ak tetutik chebo cherset. Nyorun chuto tugul ak alak eng tetutietab tililindo.
Thank you so much for joining in on the Leader program. My name is Chemtai Kirui. Tonight, I'm sitting in for Chesang Karo. On our program today, we'll be looking at WASH, which stands for Water, Sanitation, and Health. We'll be joined by Agnes Kithinji, who is all the way in Kitale at the moment, speaking to us through Zoom to discuss the issue of water, sanitation, and health. She works with the Ministry of Health on the discussions on neglected tropical diseases and WASH itself, and she's going to tell us how diseases are connected when it comes to water, sanitation, and hygiene. Through the program, we'll be looking at some of the diseases that we need to be concerned about and what we can do from our household to ensure that we prevent diseases that come with dirty water. Take a look. We can start with the introduction, tell us what you do, and then we can pick it from there. Thank you.
Okay. I'm Agnes Kithinji. I work for the Ministry of Health, Vector-borne and Neglected Tropical Diseases Unit. I coordinate WASH activities in the program, and I'm a public health specialist.
Yeah. So
Yes.
I see the issue of WASH is really integrated in the work that you're doing, right? How is it significant, really? Why should we care, especially when it comes to the public health aspect?
WASH is critical because it is one of the preventative measures. Before we get people to hospitals, we want to prevent diseases, and mostly we want to prevent waterborne diseases. And waterborne diseases are many, depending on what and how we want to look at them. For example, where I am stationed, the NTD Neglected Tropical Diseases Program, we are addressing neglected tropical diseases that are endemic in Kenya, and more so in the Lake region, and then we have Western region and also coastal region. And these neglected tropical diseases are amenable to WASH, or they are interlinked with the water, sanitation, and hygiene. For example, if I take bilharzia, a disease that, for example, bilharzia, that we know is waterborne. So most of the times people will get infected because they are either wading in the waters, and the waters are infested with snails that inhabit the disease-causing organism. So the snails support the development of the disease-causing organism, and then it penetrates the human being. When they are swimming, when they are undertaking any water-related activities like washing clothes, fetching, fishing, all those water-related activities, that is how bilharzia gets to infect these people. If we look at other diseases like soil-transmitted helminths, we see a linkage also with WASH. For example, mostly the eggs are released into the soil when people access or do not access toilets. When people defecate in the open, you will be able to see they do not, when they don't use toilets, the eggs are deposited in the soil. And when they are deposited in the soil, whatever they eat, maybe they will eat with contaminated hands. So they need to wash their hands during critical times, like after visiting the toilets, before cooking food, before eating, after changing diapers of the children, because sometimes we think children's feces are harmless. So we don't know that also children eat soil a lot, they play with toys. So that is some of the ways that people get to acquire the waterborne diseases, or neglected. Some of them are neglected tropical diseases. Of course, we have other diseases like cholera, we have typhoid, we have diarrheal diseases, but those ones now we are focusing, for us, we are focusing on neglected tropical diseases, but those ones are also related to lack of or having poor water, sanitation, and hygiene. When people don't access safe water, for example, people have to rely on water that is in dams, in rivers. We know some of these waters are contaminated. You find that in some estates, fecal matter or sewage is directed into the rivers. Of course, the rivers have their own self-cleansing methods, because, as it cascades down the valleys, it's able to self-cleanse itself. But again, to some extent, you find that the people may not know, that the common person, the common mwananchi, may not know that this water could be contaminated with maybe bacteria or any disease-causing organisms. And then when it comes to sanitation, we've seen mostly in our counties or even in our country, where people are still practicing open defecation. People are not using toilets. And some may not really know the difference or why it is important for them to have toilets. Because if they release the eggs out there, the eggs of these worms normally are released with feces. So when they are released with feces, it means that these eggs will find, and they know how to survive. So they'll survive either in the soil, and when they get into the water, they'll invade they look for the snails where they can live in a parasitic mode, and then after that, they're able to come out and become infected. So that's why people are recommended that it is important for communities to use toilets, provide and use. Of course, there are those who provide and don't use. So we are encouraging communities to understand the importance of providing toilets and using them, so that they're able, the feces and the urine, when they get into the pit, they do not have any contact with the environment, and thereby they cannot be able to contaminate the environment. So it is important that people access safe water. Safe water is water that is either treated, they can access it maybe from taps at the household level, or they are able to treat this water at the domestic level. Maybe they get to understand that they can use chlorine or water guard, or even boil this water before drinking. And so we find that sometimes we are able to break the transmission of these infections by just having maybe that toilet, using treated water, and of course, hand hygiene. And not just hand hygiene, having water, hand washing facilities that have water. If you go to most households, when we had COVID, we had each and every household had a small container that had water and soap. Today, all those containers were removed. And if you want to find out why they are not using the same, we were using them because of COVID. So you can imagine communities have never, acknowledged, or they are not aware that even the diseases that we have on day-to-day basis, that they are also transmissible, or they can be prevented by having appropriate wash in place. So I think also we need to get them to understand the relationship of these diseases and how they can be able to prevent them. And this will go a long way in making sure that these people do not even go to facilities. You find that sometimes a child will be taken to facilities for a surgery because the child has intestinal obstruction because of worms. We've had so many cases, especially now, the statistics could be there in the hospitals, how the children have been operated on because of worm, and to an extent because only what they need is maybe a dewormer and sanitation, hand hygiene. and you find that the cost of maybe the surgeries, visiting, and then post-operative, visits to hospitals, and all that time that is wasted, taking that child to hospital and all that, and even the cost of it. So those are some of the things that we can be able to avoid and have a healthy nation, free of waterborne diseases.
You've mentioned the issue of the importance of seeing what washes, like when water comes to play, and the sanitation. You've spoken about the issue of pit latrine and also hygiene, washing hands and things like. There's a lot to follow up there, but I just wanted to understand what is the correlation, because for the audience watching at home, they might think, if I want water, I go to the tap. If I want to probably have my pit latrine and washing hands. How do they correlate to the point where now we are talking about diseases like cholera or bilharzia, like you've said?
Yeah, I was trying to explain the linkage, and maybe that is the point you are putting out, the correlation. The linkage is basically when we don't have access to water. I look at it this way. A woman who does not have access to water, maybe the tap water that is treated, and it is, they can get that water directly at maybe in their compound. So what happens is that this forces the woman to go to the river. Assuming the river is slow moving and maybe it has breeding, is a breeding site for the snails that transmit bilharzia. So what happens is that she gets to the river, she will dip her legs into the water to fetch the water. What happens? The disease-causing organism that we call Cercaria will penetrate. After having undergone the cycle in the river, it will penetrate the skin and gets into her body and infect her. Mostly the snails that transmit bilharzia live in stagnant waters first, and also can be found in slow-moving rivers. And mostly when we want to wash our clothes in rivers, we will go at the edge of the river, the edges, where the water does not flow very fast. And that is where we'll find the snails attaching, and they've attached themselves along the edges. And that is where we'll find that most of the times the Cercarias will be released at that point, and the disease that is the time the woman can get the disease, or even a child, or even a man probably who has gone to fish. They'll dip their legs into the water. So that's the linkage that comes in between wash and empty, and wash and the disease. If you look at cholera, for example, maybe I can mention cholera. You find that cholera you may find that most of the times it is a bacterial infection. But what happens is that people drink contaminated water with raw sewage. For example, people release raw sewage that could have that infection, and then the water is not treated maybe at the domestic level, or maybe people access water from the rivers, and that is why, for example, they will be able to drink that water and get that infection or that disease. So basically, there is the linkage. It is either you've drank water that is contaminated and not treated, or you have gone to the rivers where the snails are, or you, for example, in hygiene concept, maybe for those who get maybe the scabies, those skin-related, the diseases that are skin-related, you find that it is still hygiene. Maybe they don't wash their bodies well, they don't have water, maybe they stay days on end without bathing. So you find that they may get those skin diseases. So those are some of the diseases that are brought about by either using the waters, or when the waters are lacking, or when they are drinking. Either you've gone into the rivers, or you've drank the contaminated water, or you've not used the water maybe for hygiene purposes. If you look at sanitation, if the eggs of the worm of bilharzia do not get access to, the environment, the soil, you'll not have them infect the man. They'll not be in my hands. For example, people go to the toilets, they come out and they don't wash their hands. They come and greet. For example, they'll go greet the next person. And most of the times there are people who do not have good hygiene even in the toilets. and maybe even the cleansing materials that they use. They will use, some will use even stones to cleanse themselves. Others will use leaves. So some of it will be left in their hands. That is very obvious. And they will go maybe open the door, leave some there, use the handles, leave some there, go greet other people, living like that. Or if they defecate in the open, the soil will get contaminated. And maybe people coming or children coming to play there, they'll pick the soil that has the eggs. They could pick them in nails, they could pick them just in their hands. And if the children are given food or the food is eaten without proper, if it is not cooked well, for example, if it is the raw fruits or vegetables that we eat without washing, there's a likelihood that the eggs could still be attached to, because normally those fruits have soil on them. You have to wash them very well with clean water. The other one is hand washing. If the hands are not washed and maybe washed with soap, because soap is the best remedy here. If the hands are not washed with soap and running water also is key word here, because sometimes we want to use clean water with a basin, meaning that you wash your hands and contaminate them again. So we also recommend that they use running water with soap to clean their hands, so that if there are any eggs attached to the hands, and because we know our hands are oily, they produce oil, or they could have some, so there is a nails, there could be also some attachment with the eggs of the worms. Yeah.
What I'm getting from you, actually, the primary thing that people need to do, and they were doing it, like you mentioned earlier during COVID, is washing their hand. And data coming from your Ministry of Health is there was a lot of decrease in some diseases because of just washing hands, being keen on that, right? Yeah. It comes down to that being the primary angle, and then pick it up from there with the other. And that's something that you mentioned earlier. People have been doing it, but I love the fact that you brought the issue of not just with water, but also running water, because the best thing we can share in the house and transfer that.
Yeah.
Agnes, there's this thing of neglected tropical diseases. You mentioned it earlier, and probably someone is hearing it for the first time and they're like, why is it neglected? What do you even mean by that? Do you mind explaining it a little bit?
Yeah, neglected diseases are just as they are neglected. And there are about 20 that we currently know. Of course, World Health Organization has listed the 20, but it has also added other 2 that we know very little about, but they are found in they cut across, they are in the whole world. So they are not just in Kenya, but they are found especially in sub-Saharan Africa. You'll find the 20 of them that I may not be able to mention all of them, but I can mention what we are addressing, or the disease that we are addressing currently in Kenya. So I can start with what we are addressing in the western counties and Lake region and the coastal region. We have bilharzia, or what we call schistosomiasis, and then we have soil-transmitted helminths or minyoo. People say minyoo ya kawaida, but si minyoo ya kawaida. Those are very serious. It's a very serious disease. And also we have leishmaniasis or kalaza, onchocerciasis. So even the names themselves are not pronounceable. So that is also brings the neglect in them. The diseases, maybe as I continue to mention them, I can also mention trachoma, which is the blinding trachoma that affects people, maybe where the sanitation also water is scarce. After trachoma, we may have also another one called lymphatic filariasis, ama tunaita matende, mapumbu. Those one, the disease affect those at the coastal region. So those are some of the ones that I can mention now, but there are other snake bites and venoming, rabies, and leprosy. All these are neglected tropical diseases, among others. But we are currently at the program, we are addressing soil-transmitted helminths, bilharzia, leishmaniasis, onchocerciasis, trachoma, and human African trypanosomiasis. So, and snake bites. So we know also jiggers are being addressed at the county level, but we don't really have a structured way of addressing jiggers, but we know the counties are addressing jiggers, which is also another neglected disease.
Yeah.
In Kenya.
From those that you've mentioned, Agnes, I understand that not all of them are caused by dirty water, but many of them, like you said, are caused by water that has not cleaned. This means like water, and in this case, clean water is really important when it comes to battling many of these cases, right?
Not all NTDs are waterborne. For example, I mentioned that the NTDs that are related are waterborne. We have bilharzia. And then we also have trachoma, which is water related, because you find that for you to get trachoma, most people get trachoma because they do not wash their faces. The faces are left unclean, especially for young children. So when the faces are left unclean, the flies, for example, if there is an infection in the home, so the transmission will take place because of flies, and also towels and the lassos and the hands if they are not clean. So that is why I was saying not all NTDs are waterborne. Others are caused by mosquito. For example, lymphatic filariasis is caused by a mosquito. Onchocerciasis is caused by a sandfly. So those are some of the things that the diseases, the parasites that will cause these diseases.